topic for us. So if we look at some of the information and numbers that we have, then we know that we probably have arthritis in at least 20% of dogs that are over 1 year of age. So I know sometimes percentages don't translate very well. So if you think about that's 1 in 5 dogs. So quite a few people have 5 dogs. Probably at least one of them has arthritis by the time it gets to over 12 months of age. And that's a pretty shocking statistic because we associate arthritis generally with those older patients. And I think it can be incredibly emotional and fairly distressing for owners to hear that their 1-year-old dog that they still perceive to be a puppy, has arthritis as a lifelong condition that we're going to be dealing with.
Yeah, and I think that's probably a really hard conversation. And we said just before we went live that I find it probably the most challenging thing is to tell an owner who's got a brand new, shiny, not broken puppy and there's a problem. And there's there's a pushback from owners because they don't want to hear it. And unfortunately, that's not going to help anybody. So what we hope today is that we're going to give you confidence that if you are seeing something, don't shy away from it because actually you shoot yourself in the foot. What you need to do is embrace it because it doesn't necessarily mean badness. You do need to know though. Is that fair to say?
Absolutely. And I think, it's one thing when we've got an x-ray or something very obvious that shows the arthritis, because you can show that to an owner and say, look, definitively, this is what we're dealing with. And I think having something in black and white to really just show someone, okay, I can't really deny this anymore. But as we said, that at least 1 in 5 dogs, have this condition. We know that x-rays don't pick this condition up until fairly late on in the process, to be honest, and even a CT scan can miss it if it's just affecting the cartilage in the joint, for example. So I think the really hard conversations are where you don't have anything definitive that you can show, but you know that this is what the dog is dealing with, and that long term this is going to be something we're going to need to manage, and that starts really the moment you have that diagnosis. That's when we start managing.
Yeah, definitely. And again, I think I just want to add here from a very human point of view, no one's going to blame anyone. I've seen this quite a lot recently where there seems to be a need to apportion blame to the owner, to the breeder, to somebody that it's happened. That isn't the case. That just doesn't apply to this situation. So don't think that you're going to have your knuckles wrapped because you've got it's not something that you've done. So don't shy away from it, but you do need a professional to examine that dog. Cool, let's go on to the next question because I think it's really relevant now. What to look for and what to do if your dog could be predisposed to arthritis?